everybody. Welcome to the Code Clarity podcast. I'm so delighted to be joined by a guest speaker today. But before I introduce Virginia, I think the premise of today's podcast is all about pharma comms with patients and with public and all the pitfalls and compliance risks that are associated, but also that we tend to get intent versus impression wrong. And one of the big reasons for this is because we haven't quite got our language right. So when we're communicating with patients and the public around disease awareness campaigns, there's a lot that we can learn from other people. And these other people I'm talking about would be people like clinical pharmacists, very used to talking to patients on a daily basis, medical writers who've really honed their skills in these areas, and of course, social media influencers who are able to put quite complex things into simple, short bits of posts that have great reach and great engagement. So I'm thrilled that we've got someone who has all of that under her belt and more. Virginia, welcome. Would you introduce yourself to our lovely audience?
Yeah, of course. So thank you so much for the lovely introduction. I'm so privileged to be here. And I am a pharmacist, so registered in the UK. I worked as a community pharmacist for 7 years in London around lots of different pharmacies. So patient contact every single day, conversations every day. And then moved to Germany 3 years ago, where I've been working as a medical writer and working with the NHS, with Orca, with Wallace Health, which is a medical communications agency, and other brands as well to help communicate what they want to get across to patients or other stakeholders, for example, healthcare professionals or whoever they're targeting in terms of their audience. And I am working with PIF, which is the Patient Information Forum, to get the Trusted Information Creator badge. So I'm part of the pilot to help more creators become accessible to charities and other people who have the PIF badge to increase the quality of healthcare communication content. I was also part of YouTube Health. I'm still part of them and doing the YouTube Accelerator course. So again, the YouTube Health initiative being to get more healthcare professionals creating content that is accessible to the public, and then working with brands to help them register as well with a licensed healthcare professional. So they have a healthcare professional on their team to produce the content. And also I've applied to be part of the WHO Fides group, which is a group of social media content creators who are all healthcare professional people. And that is, I think Fides means trust in Latin, don't quote me on that.
Yeah.
And there are just over 100 of us, and we have a reach of over 50 million people online, which is amazing. And I think that's only going to grow and grow. So I feel, I definitely started my path through medical writing and then into content creation.
Okay, so that's an interesting pathway already. But you've mentioned that word trust several times there. So tell us about the reason that you sort of got into this whole area. But I think there's a lot of people who are interested in how clinician type creators become social media influencers.
Yeah, that's a great question. So I think what really got me interested is when I got my first job to review content for an online doctor website, the information I was reviewing was not written or reviewed by healthcare professionals. So that's why they brought me in. But it was live online for people to view. And when I was reading it, I was like, oh my goodness, there are lots of inaccuracies which are clinically dangerous, essentially.
Yeah, absolutely.
To use, a word that we don't want to use in healthcare. And that then got me onto a path of medical writing in terms of how many healthcare professionals are actually writing the content, or are they just being written by someone put out there because health is a topic that everybody searches for and everybody has a health thing to sell. So everyone's really health conscious, especially around COVID time when everybody just went straight on the internet. So then I built my portfolio, joined Wallace Health Agency and helped launch As the Online Doctor. So a lot of companies didn't even think that the internet was a place people were searching for health information or to launch their services on there. So I thought, wow, I can't believe Asda, huge brand, doesn't have an online doctor with accessible information. And they were helped by Zava Online Doctor, who had been doing it for years, I think 10 years at that point in Germany, America, and UK. And so I thought, okay, there's a lot of potential here, and nobody's really doing video. There are, at the time, only a handful of healthcare content creators who were doing video, and understandably so. Video is hard work. You have to script, you need to think about what you're saying, and once it's out there, and a lot of people are consuming healthcare content through video, more so through reading. Of course, it's more accessible, it's more engaging. And then obviously a lot of misinformation during COVID as well. And then seeing how social media platforms were tackling that issue made me think, okay, there's a massive urgent need for people to be consuming content that's been created by people who know what they're talking about, who are actually going to put in the effort to research and present credible information, and then also link to those sources and then review that information. So the NHS website is one of the few websites that has a content style guide, which I adopted and still use today. And then even so, I still develop my language even further to, I don't believe in oversimplification. I believe in accessibility. So
we shouldn't be striving to oversimplify. That's really interesting, isn't it? So is there any example of that? Because I remember last week we were chatting about the use of the word symptoms, which is just what we use, right, every day.
Yeah, so that is a word that we take for granted, I think. That it means so many things to so many people. But for someone who's consuming content, I have broken down the word symptoms into what does it look like, or even what does it feel like. And I think that's much more understandable, especially to people who have English as a second language, like my parents. So they were really pivotal in giving me feedback for my early content and saying, you speak too fast, or the subtitles aren't big enough, or I didn't understand this, it's too difficult for me to understand. And so I really appreciate their feedback, because it means that I'm able to create even better content from real people who are watching my content and don't necessarily have the background that I have in healthcare, especially my mom, whose English is of a much lower grade than my dad's. And obviously they love me as well, but their honesty is what's important to me. So getting honest feedback is so important.
But that's amazing. You have this frame of reference, right? Because if your parents, you're kind of, if it gets through them, if it gets their vote of approval, you've done a good job. That's actually really useful. And I know we have all sorts of in pharma, we have sorts of readability tests and things like that. But let's just talk a little bit about credibility, because as well as those big words like trust and misinformation, credibility is really important. How will the average member of the public visiting your channel and looking at your content know that this is credible versus someone who's not on the YouTube health program and who isn't verified and that kind of stuff? What's the difference there?
I think the biggest difference is that I often collaborate with the NHS. So my videos are on the NHS channel as well. And then on Instagram, we have that collaboration tool where you can see our bubbles together. Our accounts are linked. And also I take a lot of care and attention to create my scripts. So I do a lot of research. It takes me about 2 hours to even research a script that ends up only being about 5 or 6 sentences. Because I have to be really careful about the words that I use and make sure that they are the most up-to-date information that we have. And recently working with PIF prompted me to do the same thing the NHS website does, which is have a review date at the bottom of your content. So I can see the date it was created and the date that is due a review, and they recommend reviewing your content every 3 years or as soon as you find out new information. So it's about having that process as a creator. And then also I'm registered, so you can go look me up on the GPHC website.
That's amazing. So people can feel like really reassured looking at your content. And I love that sort of badge of honor being in partnership with the NHS. Let's talk a little bit about sort of pharma now, because I mean they are very very busy creating loads of disease awareness campaigns. Some of them are on social, some of them are still using things like posters, print, and you'll see a lot of it also on websites. What would be your suggestions? I mean, we've mentioned there about simplicity, oversimplification, and language. What do you think pharma could potentially learn from you? Because you've talked about credibility and trust as well. What could they learn from you when they're communicating with the public?
I think for me in particular, it would be about how you use language, but also how you present the information. So even the tonality in how you speak is so important, because you need to sound empathetic and sincere. You can't really sound loud and excited and proud if you're talking about a really sensitive topic.
Yeah.
And I think it's important to get that right. And so working with collaborators, I'm going to call them collaborating with creators like me or other doctors or other healthcare professionals that have been practicing with patients direct contact for years, then we know what to say. And also we have case studies from real life experiences that we can share, that we can integrate into scripts. And it's important to have someone like that on your content strategy team. So that would be the kind of main thing I would recommend, is working on strategy with a creator who has that patient contact. And it's okay to use long words, but make sure that you explain them in a really easy to understand way, so that people are not afraid of engaging with your content in future. So they feel like you are really helping them by understanding where they are coming from in terms of, you know, their background, in terms of, you know, having English as a second language, or maybe not being from England.
Or just not having a medical degree, you know.
Exactly.
I mean,
Health
quite a lot of
literacy.
those people.
Yeah,
Absolutely. And I remember the YouTube Health event, which is where we met. Somebody was on stage presenting, saying you could have a patient in front of you who can be nodding through everything that you're telling them, and will be up in the middle of the night, you know, scrolling and Googling and trying to find really accessible content just to explain to them what the doctor said, that they're too polite to sort of say, you know, I don't understand what it is that you're saying. So I thought that I really took that away as a key learning. But nice segue, I think, into the last question that I want to put to you, Virginia. And it's a big one, but, you know, given that you've got this wealth of knowledge and experience, and, you know, you've got credibility through your working partnerships, would you, or maybe how would you work with pharmaceutical companies?
So I think rather than having their logo on my content, it would be better if I create a plan or a strategy for them to follow, and they can invest in medical writers to work on that content. So I think one of the daunting aspects of creating health information is that there are so many things you need to consider before you put out a single piece of content, and that can be a real bottleneck. So if you have a plan that, you know, someone has used, that is approved, then you can just get stuff done faster and reach your target audience, which are honestly patients at this point. And then also, if healthcare professionals see your content as being patient friendly, then that can kind of sway them as well to recommend your content, which again needs to be unbiased, and it needs to be about disease awareness. And I think there are definitely some opportunities there. And the sooner you start creating that type of content and you start developing those processes, you know, you get that PIF approval, you follow those NHS content guidelines, you get your YouTube health badge on your channel, which no other social media channel is using, by the way, at time of recording. So that's a really big credibility badge. And I do consult with brands at the moment. So I'd rather consult and give a strategy and a plan rather than
and let them execute it. Yeah, makes perfect sense. Well, listen, it's no mean feat, I think, to research the topics that you do, to put together, you know, this content. We appreciate that must take some time. But also, somebody said to me ages ago, only a genius can make something complex simple. And I think, you know, it's not to be sniffed at. When we look at these shorts, we don't necessarily appreciate how much has gone into that in the background. And really reassuring, I think, to hear that there's reviews that go on, that you do look at content, that you do amend stuff. So that's all absolutely brilliant. I think you're doing wonderful things, Virginia. Please continue. And thank you so much for your time.
Thank you so much. I hope to continue as long as I can and collaborate with other healthcare creators as well. Gives us bigger impact.
Excellent. Cool. Thanks so much, Virginia.
Thank you.